Hello and welcome back to AP Psychology. I'm Miss Lee. We're still in Unit 8, and in this video we'll be covering the schizophrenia spectrum and psychotic disorders. By the end of this video, you should be able to discuss the major diagnostic categories, including schizophrenia spectrum and other psychotic disorders and their corresponding symptoms. If you haven't done so already, go ahead and grab your notes and let's get started. Okay, so when we're talking about schizophrenia and really any of these disorders in this video, it's important to remember that psychosis is a symptom, not an illness, in which thoughts and emotions are so impaired that contact is lost with external reality. Schizophrenia is now on a spectrum to encompass the many and varying degree of symptoms that a person can have and still be identified as having schizophrenia. If depression is the common cold of psychological disorders, then schizophrenia is the cancer. Nearly 1% of people suffer from schizophrenia, and throughout the world, 24 million people suffer from this disease. It strikes young people as they mature into adults. The symptoms usually begin to appear somewhere between 18 and 20, and it affects men and women equally. However, men suffer from it more severely than women. This graphic shows you a little bit about how prevalent schizophrenia is throughout the globe. It is present everywhere. It's in every culture. And historically, we've seen evidence of schizophrenia being present really as early as history is able to record. The literal translation of schizophrenia is split mind. This is different than what you might think. This is a split from reality that shows itself in the following ways: disorganized and delusional thinking, which is the same thing as delusions, disturbed perceptions, typically hallucinations, and then inappropriate emotions and actions. So we're talking about behaviorally and psychologically. Disorganized thinking, you see this quote from the body of work called I'm Mary Poppins. This morning when I was at Hillside, which is a hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday. This monologue illustrates fragmented, very bizarre thinking with distorted false beliefs called delusions. Many psychologists believe that disorganized thoughts occur because of selective attention failure, resulting in fragmented, bizarre thoughts that spill out in no particular order. Basically, every piece of information is coming in and it's being processed at the same time. If you think back to our sensation and perception unit, you hopefully remember selective attention and how we are able to really only focus on a couple of bits of information at once. The belief here is that these disorganized thoughts are a result of a severely impaired ability to selectively attend to all of the information coming in. A schizophrenic person may perceive things that are not there, which is hallucinations, and they may be displaying emotions and actions that are not appropriate to the situation. A schizophrenic person may laugh at the news of someone dying or show no emotion at all, and this is often referred to as either flat affect or apathy, the not showing any emotion. With regard to schizophrenia, you either have positive symptoms or negative symptoms, and in keeping with the kind of psychological format, this doesn't mean good or bad. Positive symptoms are either a distortion or an excess of normal functions and tend to be the most frequent in the first stages or early episodes of schizophrenia. And this is in addition to normal functions. It's basically the presence of something that's not supposed to be there. It includes delusions, hallucinations, disordered speech, which often results in a phenomenon known as word salad, and disorganized behavior. Delusions are distorted false beliefs. Delusions are usually of either persecution, like someone's out to get me, or grandeur, like I'm Superman. Hallucinations are the perception of some type of event without the corresponding sensation, and frequently such hallucinations are auditory and less often visual, tactile, olfactory, or gustatory. So really any of the senses can be utilized in these hallucinations. Disorganized speech or word salad. This is disordered thoughts leading to jumbled words that don't really make any sense to the listener. They make sense to the person saying them, but not to the listener. Disorganized behavior. Patients with schizophrenia often have motor behaviors that are inappropriate. The individual may perform senseless or compulsive acts like continually rubbing an arm or rocking a chair. The negative symptoms are behavioral deficits or the loss or decrease of normal functions. So this is basically missing or subtracting of normal functions. and this could be the absence of appropriate behavior. This can include a flat affect. This is avoiding eye contact, a face that doesn't have any kind of expression at all, apathy and non-interest, and a monotone voice. There can be poverty of speech. Basically, there are long lapses or very slowed speech. There can be a lack of directedness, so the movements of the individual can be slowed down, and they may have very little interest in social participation. When schizophrenia is slow to develop, this is considered to be a chronic or process type of disorder. Recovery is doubtful. Such schizophrenia usually displays negative symptoms. When schizophrenia rapidly appears, this is considered acute or reactive. The recovery tends to be better. Such schizophrenia usually shows positive symptoms. Common characteristics. In addition to the common positive or negative symptoms described before, you can also see paranoia, which is a preoccupation with delusions and hallucinations, often with themes of persecution or grandiosity, or catatonia. This is immobility or excessive purposeless movements. This is extreme negativism and or parrot-like repeating of another's speech or movements. This is sometimes known as echolalia. A newer disorder in this family of disorders is childhood schizophrenia. Childhood schizophrenia is essentially the same as schizophrenia in adults, but it occurs earlier in life and has profound impact on a child's behavior. It can include hallucinations, delusions, irrational behavior and thinking, and problems carrying out routine daily tasks such as bathing. Schizophrenia is a disease of the brain exhibited in the symptoms of the mind. There are brain abnormalities that can be seen, that can be measured. There is a dopamine overactivity. Researchers have found that schizophrenic patients express higher levels of dopamine D4 receptors in the brain. Brain scans also show abnormal activity in the frontal cortex, the thalamus, and the amygdala of schizophrenic patients. Adolescent schizophrenic patients also show brain lesions. So if you take a look at these images, you can see the tissue loss in normal adolescents compared to the tissue loss in adolescents with schizophrenia. Schizophrenia patients may express morphological changes in the brain like enlargement of fluid-filled ventricles. So the anatomy is actually different in the brain of a person with schizophrenia. There is abnormally low activity in the frontal lobes. We also are able to see an overly active thalamus, which most people believe to be related to the hallucinations that schizophrenic patients experience. And the greater the shrinkage of the hippocampus and amygdala, the worse the disorder. So there's definitely a relationship going on there. If the thalamus is small, there is greater difficulty in filtering information and possibly reacting in the correct manner. So why do these brain abnormalities even occur? Some hypotheses include a possible relation to prenatal problems, a low birth weight, some type of complications during the actual birth, and infections that the mother has during pregnancy, especially influenza during the middle of fetal development. There are also genetic factors. The likelihood of individuals suffering from schizophrenia is 50% if their identical twin has the disease. Early warning signs of schizophrenia include a mother's long-lasting schizophrenia, birth complications such as oxygen deprivation and low birth weight, short attention span and poor muscle coordination, disruptive and withdrawn behavior, emotional unpredictability, and finally, poor peer relations and solo play. And that is it for schizophrenia. That concludes all of our disorders that we'll be discussing in this unit. In our next video, we'll be talking about treatment. I can't wait to see you then. Bye for now.